Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's understand the Lepra reactions. The Lepra reaction, there is type 1 and type 2. So first we look at the type 1. The type 1 is mainly seen in the borderline spectrum. So it is seen in the borderline spectrum, and it is mostly severe in the borderline leprosy. It is most severe in terms of the borderline leprosy. Next, it is usually seen within the 12 months. So it is seen within 12 months of initiation of the multi-drug therapy. So it is seen within 12 months of the multi-drug therapy. Next, what hypersensitivity reaction is it involved in? So hypersensitivity is 4. So the easy way to remember is type 1 plus dash is equal to 5. So type 1 plus 4 will be equal to 5. So that's how you easily memorize it. So it is type 4 hypersensitivity. And next is the due to the enhanced cell mediated. So it is an enhanced cell mediated response, and it is increased destruction. There will be an increased destruction to the bacilli following the treatment or reversal. The increased destruction of bacilli. Next, it includes the inflammation of the existing skin lesions. There is significant inflammation of the existing skin lesions. And that is, it can be red, painful, edematous skin lesions. They can ulcerate as well. The new lesions, it may occur, but it is very rare. So new lesions are rare. And next, there can be presence of the neuritis and the nerve abscess as well. So neuritis plus nerve abscess can be seen. Next, what about the systemic involvement? Is there a systemic involvement in type 1? The answer is no, there is no systemic involvement. So how do you treat this type 1 Lepra reaction? The treatment of type 1, it includes supportive therapy for mild reactions. So there's supportive therapy and supportive therapy for mild reactions. Supportive therapy for mild reactions, it includes the NSAIDs. Next, in cases of severe reactions, in terms of severe reactions, it is with the neuritis and the eye lesions, with neuritis and also the eye lesions. So in such cases, it is the oral corticosteroids. Oral corticosteroids. Now let's look at the drug of choice. So oral corticosteroids is the drug of choice. Next, the nerve abscesses. So in such cases, there is additional surgical drainage, and other drugs which are used are the clofazimine as well as the cyclosporine. Now let's jump to the type 2. So Lepra reaction type 2 is also known as the erythema nodosum and leprosum. So this type 2 is seen in case of the lepromatous leprosy being greater than the BL. So lepromatous leprosy, it amounts to about 50% of the cases. So the other thing is this lepromatous leprosy, it is unrelated. It is unrelated to the multi-drug therapy, and it may occur before or during or after treatment. It occurs before, during or after the treatment. So what type of reaction is this? So the sum amounts to 5. So in case of the type 2, 2 plus what will give you 5? It is 3. So this is hypersensitivity 3, and it is primarily humoral. It is humoral, and there is a immune complex deposition. Immune complex deposition in tissues and the vessels. The cytokine involved is TNF alpha. TNF alpha is included in the type 2 of the Lepra reaction. Next, we look at how are the lesions. There is new, erythematous and tender. It is new, erythematous and tender, and the cutaneous and the dermal nodules that are widely distributed. So cutaneous and dermal nodules, they are widely distributed over the extremities and also the face. The existing lesions do not change. Next is the treatment aspects. On treatment, there is oral corticosteroids. Oral corticosteroids is a first line drug. Next, the other drugs includes the clofazimine. That is, it includes a steroid dependent ENL. Next is there is also the thalidomide. Thalidomide is the most effective. Thalidomide is most effective, but it has various side effects. Because of side effects, it is not given much. So there is oral corticosteroids, clofazimine and thalidomide. Channel.